Amiodarone, a potent antiarrhythmic medication, has been a cornerstone in the management of various cardiac rhythm disturbances for several decades. Its unique pharmacological properties and broad spectrum of activity have made it an invaluable tool in the armamentarium of cardiologists and healthcare professionals worldwide. In this comprehensive video, we will delve into the common uses, benefits, potential adverse effects, dosage recommendations, and dangers associated with this widely prescribed drug. Amiodarone belongs to a class of medications known as Class III antiarrhythmic agents, which primarily prolong the action potential duration and refractory period of cardiac cells. This mechanism of action contributes to its efficacy in treating various types of arrhythmias, or abnormal heart rhythms. However, it is crucial to understand that amiodarone is a powerful medication with a complex pharmacokinetic profile and potential for significant side effects, necessitating careful monitoring and consideration. As we explore the intricacies of amiodarone, it is essential to approach its use with a balanced perspective, weighing the potential benefits against the risks, and considering alternative treatment options when appropriate. By understanding the nuances of this medication, healthcare professionals can make informed decisions and optimize patient outcomes. Common uses of amiodarone. Amiodarone is primarily utilized in the management of various cardiac arrhythmias, including ventricular arrhythmias, ventricular tachycardia, VT, ventricular fibrillation, VF, atrial arrhythmias, atrial fibrillation, AF, atrial flutter, other arrhythmias, paroxysmal supraventricular tachycardia, PSVT, Wolff-Parkinson-White syndrome. Amiodarone is often considered a second-line or third-line treatment option for these arrhythmias, particularly when other antiarrhythmic medications have failed or are contraindicated. Its broad spectrum of activity and effectiveness in various arrhythmia types make it a valuable tool in the management of complex cardiac rhythm disorders. Benefits of using amiodarone. Despite its potential side effects, amiodarone offers several significant benefits that have contributed to its widespread use in clinical practice. Efficacy in treating arrhythmias. Amiodarone has demonstrated remarkable efficacy in suppressing and managing various types of arrhythmias, including those that are resistant to other antiarrhythmic agents. Broad spectrum of activity. Unlike many other antiarrhythmic drugs, amiodarone exhibits a broad spectrum of activity, making it effective against a wide range of arrhythmias, from atrial fibrillation to ventricular tachycardia. Oral and intravenous administration. Amiodarone can be administered both orally and intravenously, providing flexibility in treatment regimens and allowing for rapid loading in acute situations. Long half-life. Amiodarone has an exceptionally long half-life, ranging from several weeks to months, which allows for less frequent dosing and sustained therapeutic levels. Potential for cardioversion. In some cases, amiodarone can facilitate the conversion of certain arrhythmias, such as atrial fibrillation, to normal sinus rhythm through cardioversion procedures. Reduced risk of proarrhythmia. Compared to some other antiarrhythmic agents, amiodarone has a relatively lower risk of inducing life-threatening arrhythmias, a phenomenon known as proarrhythmia. Potential adverse effects of amiodarone. While amiodarone offers significant therapeutic benefits, it is essential to be aware of its potential adverse effects, which can be numerous and sometimes severe. These adverse effects can affect various organ systems and may require close monitoring and management. Pulmonary toxicity. Amiodarone can cause lung toxicity, including interstitial pneumonitis, pulmonary fibrosis, and acute respiratory distress syndrome, ARDS. Regular monitoring of pulmonary function and chest imaging may be necessary. Hepatotoxicity. Amiodarone has been associated with liver injury, including elevated liver enzymes, hepatitis, and, in rare cases, liver failure. Thyroid dysfunction. Amiodarone can interfere with thyroid hormone metabolism, leading to either hypothyroidism or hyperthyroidism. Regular monitoring of thyroid function tests is recommended. Neurological effects. Amiodarone has been linked to various neurological side effects, such as peripheral neuropathy, tremors, ataxia, and in rare cases, optic neuropathy. Skin discoloration and photosensitivity. Amiodarone can cause a bluish-gray discoloration of the skin, as well as increased sensitivity to sunlight and ultraviolet radiation. Cardiovascular effects. While amiodarone is primarily used to treat cardiac arrhythmias, it can also cause adverse cardiovascular effects, including bradycardia, conduction disturbances, and, in rare cases, torsades de pointes, a life-threatening ventricular arrhythmia. Gastrointestinal effects. Amiodarone has been associated with gastrointestinal side effects, such as nausea, vomiting, constipation, and anorexia. Ocular effects. Amiodarone can cause various ocular side effects, including optic neuropathy, corneal deposits, and visual disturbances. It is crucial for healthcare professionals to carefully weigh the potential benefits of amiodarone against its risks and to closely monitor patients for any adverse effects during treatment. Dosage recommendations for amiodarone. Amiodarone has specific dosing guidelines that should be followed to maximize its therapeutic efficacy while minimizing the risk of adverse effects. The dosage regimen typically consists of a loading phase and a maintenance phase. Loading phase. Intravenous IV loading. Typically, an initial IV loading dose of 300-1,200 mg is administered over 24 hours, followed by oral maintenance therapy. Oral loading. An oral loading dose of 800-1,600 mg per day, divided into multiple doses, is often prescribed for several weeks. Maintenance phase. Oral maintenance dose. The typical oral maintenance dose ranges from 200,400 mg per day, administered once daily or divided into multiple doses. It is important to note that dosage adjustments may be necessary based on various factors, such as age, renal function, hepatic function, and concomitant medications. Close monitoring of therapeutic drug levels and clinical response is recommended to ensure optimal treatment outcomes and minimize the risk of adverse effects. Understanding the dangers of amiodarone. While amiodarone is an effective and widely used antiarrhythmic medication, it is essential to understand the potential dangers associated with its use. These dangers can be severe and, in some cases, life-threatening, highlighting the importance of careful patient selection, monitoring, and risk-benefit assessment. Pulmonary toxicity. Amiodarone-induced pulmonary toxicity is a serious and potentially fatal complication. It can manifest as interstitial pneumonitis, pulmonary fibrosis, or acute respiratory distress syndrome, ARDS. Early recognition and prompt discontinuation of the drug are crucial in managing this condition. Hepatotoxicity. Amiodarone can cause significant liver injury, including elevated liver enzymes, hepatitis, and, in rare cases, liver failure. Regular monitoring of liver function tests is essential, and discontinuation of the drug may be necessary if severe hepatotoxicity occurs. Thyroid dysfunction. Amiodarone can disrupt thyroid hormone metabolism, leading to either hypothyroidism or hyperthyroidism. Both conditions can have serious consequences if left untreated, and close monitoring of thyroid function is necessary during treatment. Proarrhythmia. While amiodarone has a relatively low risk of inducing life-threatening arrhythmias compared to some other antiarrhythmic agents, it is not entirely free from this risk. In rare cases, amiodarone can precipitate ventricular arrhythmias, such as torsades de pointes, which can be life-threatening. Cardiovascular effects. Amiodarone can cause adverse cardiovascular effects, including bradycardia, conduction disturbances, and, in rare cases, heart failure or cardiogenic shock. Ocular toxicity. Amiodarone can cause various ocular side effects, including optic neuropathy, corneal deposits, and visual disturbances. Regular ophthalmologic examinations may be necessary during prolonged treatment. Interactions with other medications. Amiodarone has numerous potential drug interactions, which can increase the risk of adverse effects or alter the efficacy of other medications. Careful review of concomitant medications and monitoring for potential interactions are crucial. It is essential for healthcare professionals to carefully weigh the potential benefits of amiodarone against its risks and to closely monitor patients for any adverse effects during treatment. Prompt recognition and management of adverse effects are crucial in mitigating the dangers associated with amiodarone use. Precautions and considerations when using amiodarone. Given the potential for serious adverse effects and the complexity of amiodarone therapy, several precautions and considerations should be taken into account when prescribing and administering this medication. Patient selection. Amiodarone should be reserved for patients with significant arrhythmias that pose a risk to their health or life, and for whom other antiarrhythmic medications have been ineffective or are contraindicated. Baseline evaluations. Before initiating amiodarone therapy, patients should undergo a comprehensive baseline evaluation, including pulmonary function tests, PFTs, chest imaging, e.g., chest X-ray or CT scan, liver function tests, LFTs, thyroid function tests, TFTs, ophthalmologic examination, electrocardiogram, ECG, monitoring during treatment. Regular monitoring is essential during amiodarone therapy to detect potential adverse effects early and adjust treatment accordingly. This may include periodic PFTs, chest imaging, LFTs, TFTs, and ophthalmologic examinations. Monitoring of electrolyte levels and renal function. Electrocardiogram, ECG, monitoring for conduction disturbances or arrhythmias. Medication interactions. Amiodarone has numerous potential drug interactions, and healthcare professionals should carefully review a patient's medication list and adjust dosages or consider alternative therapies when necessary. Sun protection. Patients taking amiodarone should be advised to use sun protection measures, such as wearing protective clothing, using sunscreen, and avoiding excessive sun exposure, due to the risk of photosensitivity reactions. Patient education. Patients should be thoroughly educated about the potential risks and benefits of amiodarone therapy, as well as the importance of adhering to monitoring schedules and reporting any adverse effects promptly. Dose adjustments. Amiodarone dosages may need to be adjusted based on factors such as age, renal function, hepatic function, and concomitant medications. Close monitoring of therapeutic drug levels and clinical response is recommended to ensure optimal treatment outcomes. Alternative therapies. Healthcare professionals should consider alternative antiarrhythmic therapies or non-pharmacological interventions, such as catheter ablation or implantable cardioverter defibrillators, ICDs, when the risks of amiodarone outweigh the potential benefits. By adhering to these precautions and considerations, healthcare professionals can optimize the safe and effective use of amiodarone while minimizing the risk of adverse effects and ensuring the best possible outcomes for their patients. Alternatives to amiodarone for similar conditions. While amiodarone is a valuable antiarrhythmic medication, there may be situations where alternative treatments are preferred or necessary. Some alternatives to amiodarone for the management of cardiac arrhythmias include other antiarrhythmic medications. Class IA agents, e.g., quinidine, procainamide. Class IB agents, e.g., lidocaine, mexiletine. Class IC agents, e.g., flecainide, propafenone. Class III agents, e.g., sotalol, dofetilide. Catheter ablation. This minimally invasive procedure involves the use of radiofrequency or cryoablation to create scar tissue in specific areas of the heart, disrupting the abnormal electrical pathways responsible for arrhythmias. Implantable cardioverter defibrillators, ICDs. These devices are implanted in patients at high risk for life-threatening ventricular arrhythmias. They can detect and terminate arrhythmias through electrical shocks or pacing. Surgical interventions. In some cases, surgical procedures such as maze procedures for atrial fibrillation or ventricular aneurysm resection for ventricular tachycardia may be considered. Non-pharmacological approaches. Lifestyle modifications, e.g., weight loss, exercise, dietary changes. Management of underlying conditions, e.g., heart failure, thyroid disorders. Stress management techniques. The choice of alternative therapy depends on various factors, including the type and severity of the arrhythmia, patient characteristics, comorbidities, and individual preferences. Healthcare professionals should carefully evaluate the risks and benefits of each treatment option and involve patients in the decision-making process. Frequently asked questions about amiodarone. What is amiodarone primarily used for? Amiodarone is primarily used to treat various types of cardiac arrhythmias, including ventricular tachycardia, ventricular fibrillation, atrial fibrillation, and atrial flutter. How does amiodarone work? Amiodarone is a Class III antiarrhythmic agent that prolongs the action potential duration and refractory period of cardiac cells, thereby suppressing abnormal electrical activity and reducing the risk of arrhythmias. What are the common side effects of amiodarone? Common side effects of amiodarone include pulmonary toxicity, hepatotoxicity, thyroid dysfunction, neurological effects, skin discoloration, photosensitivity, gastrointestinal effects, and ocular effects. How is amiodarone administered? Amiodarone can be administered both intravenously, IV, and orally. It typically involves a loading phase followed by a maintenance phase, with dosages adjusted based on individual patient factors. Is amiodarone safe for long-term use? While amiodarone can be used for long-term management of arrhythmias, its potential for serious adverse effects necessitates close monitoring and periodic evaluation of the risks and benefits. Are there any interactions with other medications? Yes, amiodarone has numerous potential drug interactions, and healthcare professionals should carefully review a patient's medication list and adjust dosages or consider alternative therapies when necessary. Can amiodarone be used during pregnancy or breastfeeding? Amiodarone is generally not recommended during pregnancy or breastfeeding due to potential risks to the fetus or infant. Alternative treatments should be considered in these situations. What should I do if I experience side effects while taking amiodarone? If you experience any side effects while taking amiodarone, it is important to promptly report them to your healthcare provider. Depending on the severity and nature of the side effects, your healthcare provider may adjust the dosage or consider alternative treatments. Are there any lifestyle modifications recommended while taking amiodarone? Patients taking amiodarone should avoid excessive sun exposure and use sun protection measures due to the risk of photosensitivity reactions. Additionally, maintaining a healthy lifestyle, including a balanced diet and regular exercise, may be beneficial. When should amiodarone be discontinued? Amiodarone should be discontinued if severe adverse effects occur, such as pulmonary toxicity, hepatotoxicity, or life-threatening arrhythmias. Your healthcare provider will carefully evaluate the risks and benefits of continuing or discontinuing the medication. Conclusion and final thoughts on amiodarone. Amiodarone is a powerful and widely used antiarrhythmic medication that has played a crucial role in the management of various cardiac rhythm disturbances. Its unique pharmacological properties and broad spectrum of activity have made it an invaluable tool for healthcare professionals worldwide. However, it is essential to approach amiodarone therapy with a balanced perspective, weighing the potential benefits against the risks and considering alternative treatment options when appropriate. Throughout this comprehensive video, we have explored the common uses, benefits, potential adverse effects, dosage recommendations, and dangers associated with amiodarone. We have emphasized the importance of careful patient selection, baseline evaluations, and regular monitoring to mitigate the risks and optimize treatment outcomes. While amiodarone has demonstrated remarkable efficacy in suppressing and managing various types of arrhythmias, its potential for serious adverse effects, such as pulmonary toxicity, hepatotoxicity, and thyroid dysfunction, cannot be overlooked. Healthcare professionals must remain vigilant and promptly address any adverse effects that may arise during treatment. It is crucial to involve patients in the decision-making process, thoroughly educating them about the risks and benefits of amiodarone therapy, and ensuring their understanding of the importance of adhering to monitoring schedules and reporting any adverse effects promptly. In situations where the risks of amiodarone outweigh the potential benefits, or when alternative therapies may be more suitable, healthcare professionals should consider non-pharmacological interventions, such as catheter ablation or implantable cardioverter defibrillators, ICDs, or explore other antiarrhythmic medications.